All right, so it has been a year since my crazy back injury, and I call it crazy because it was the worst pain I've ever had in my whole entire life, where it felt like somebody was ripping out my sciatic nerve, where volcanoes were exploding in my calf. There was no position of relief. I felt like I was dying. I told my husband that multiple times, that I was dying, because the pain was so crazy. And if you've ever had any type of nerve pain from a disc extrusion, you know exactly what I'm talking about. It is one of the worst pains in the world. So a lot of patients ask me what caused it. And for most of us, there's not just one thing that caused your disc herniation or disc extrusion. Usually it's multiple things. Unless you've been in a car accident or had some type of crazy trauma, it's usually years of repetitive movements. There's a lot of factors. I'll go into mine. Part of it's genetics. My dad has had multiple back surgeries, and he had permanent foot drop, where he still does. He has to wear a brace now. I actually did not crawl as a child. I scooted everywhere and then went straight into walking. So crawling is critical for the development of your spinal curves. And because I scooted, my curves are quite messed up, as you can imagine. So that messed up the weight of my spine being displaced between my discs and my joints. So a lot more weight was on my discs. Then I did CrossFit, and I absolutely loved it at the time. I felt so awesome and strong, and I could do some crazy things. But with the shape of my spine, probably not the best idea, but I do not regret it, because I made some great friendships during the time. And I had a couple injuries during that time on my neck and my back, but it did go away. So I had pain for a couple weeks and went away. And then my husband and I bought our house, and we wanted to make our backyard a paradise. So we spent 2 years of doing crazy backyard projects. We cleared some land, and if you know what kudzu or potato vine is, that is a psychotic plant that does not die. It's all over the trees, all through the ground. It's so strong, it's out of control. And I thought I was a strong person, but I could just not even break this plant. So we did that. Then we planted a million plants, and then I didn't like where they were, so then we moved them, and then we mulched everywhere, and we sodded, and we built a wall. So it was a lot. And during that time I did have back pain off and on, but never this type of crazy pain that I had a year ago. So lots of people want to know too, like when they come in, how long is it going to take for me to get better? And that's a very difficult question to answer, because it depends on how long the pain has been going on. It depends on what has happened in your life to cause it. Have you been sitting at a desk for hours on end, shortening your muscles? Are you stretching? Are you hydrating? Are you inflamed? Do you have lack of blood flow to certain areas to oxygenate the tissues to heal? So there's a million factors. And usually when you have initial injuries, like I did years ago when I did CrossFit, it got better within 2 weeks. And so when patients come in and they've had an injury that they've had 5-10 years ago, and they say, well, this time it's taking forever. Last time I had back pain, it got better in 5 days, 2 weeks, a month, whatever it might be. But you can't compare apples to apples when we talk about back pain, because there's so many different causes to back pain. And when we're talking about a disc extrusion like I had, I had complete loss of sensation and muscle strength in my left leg. I walked with a limp for several months, had severe pain in my leg and could not stand. It was a very tough year last year, and I tried to hide it from everybody because here I am, a chiropractor, and I have severe back pain. But very grateful to actually be a chiropractor because I did spinal decompression twice a day. I got adjusted daily. I actually purchased our new machine that we have, our focused shock wave or piezo wave, for my disc extrusion. That's the reason I got it. And I used it over my disc as well as throughout my whole leg. I got massages, I did red light. I tried to walk as much as I could, although there were days where I would start to go for a walk with my husband and the pain got so severe where he would have to pick me up in the golf cart. But I knew movement was important, so every day I would test it out and see what I could do. But because I did all these therapies together, and patients sometimes don't realize, and my dad has the same mindset where I don't want to do too many therapies together because I won't know which one worked, but they all work together and they're all treating different things. The spinal decompression was amazing for my disc herniation, and the focused shockwave was great for the disc, as well as all the damage that happened from the disc extrusion in my leg, in my muscle. I could not go up onto my tippy toes for 6 months. And then at the 7th month mark, I had another disc extrusion in the level above that, which was so severe again. And we drove to the ER because I thought I was dying again, but thank God I wasn't dying. But I didn't end up going into the ER because, number one, we didn't have health insurance at the time. And number two, or I would say number one, is I hate hospitals more than anything in the world. So we sat there in the parking lot and talked about it. And then I was actually able to be in a position where I wasn't dying. So we ended up driving home. But with that injury, I had foot drop. So again, not able to walk. So frustrating, especially after I had been through 6 months of trying to recover from the previous disc extrusion, and then to have one in the level above that to start all over again. But luckily with this one, I'm still not at 100%. I still have loss of sensation, and I don't have my full strength back in my leg, but I would say I'm about 85%. So I'm doing a lot more. I've added in yoga because for the past year, I did not bend. I was terrified to bend at all. I kneeled all the time. I got knee pads because basically that's all I did was crawl around on my knees because I could not bend. I was very scared to even bend, but also it was painful to bend. So now that I'm doing yoga, I've bent more than I have in the past year in just 1 week of yoga. But I can do it, and it's amazing to explore like actually what I can do. And I've noticed the sensation coming back a little bit more. I've noticed the strength. My balance is still horrible on my left leg, but I know that as I get older, balance is so critical to you don't want to fall and break a hip. So now is the time to fix these things, and I do feel like yoga is very critical in rehabbing my injury, and then doing things like the decompression, the focused shock wave, adjustments, massage, and the red light. I mean, they all work together to address inflammation, healing, nutrients into the disc, movement in the joints around the disc, and stimulating healing on a cellular level much deeper than we can get with our hands is what we get with the focused shockwave. So lots of information there, but my past year has been crazy. But I would like to say I'm super excited because I do feel very positive. I'm on the upswing. I did not get surgery. I did not get a steroid injection. I, in my mind, maybe know too much, but for me personally, I did not want to go that route. I do not judge anybody because, oh my God, that pain is so crazy and painful that I totally understand why people do get surgery. I understand why people get steroid injections, and there is no judgment ever placed on anybody to get out of the pain that they're in because it's the worst thing in the world. And I feel like by going through this injury myself, I can completely relate with my patients. I know these injuries, their ins and outs, the pros and cons of all the different options that you have. And I do want you to know you have so many options to treat these injuries. You just need to seek them out and do what feels best for you. And for me, I did not want to go to the surgery route because my father went the surgery route, and he had multiple back surgeries, all still not addressing the issue, and still has foot drop to this day. So I'm hoping to have 100% recovery, but 85%, I will take it. And because I did so many therapies right away, the pain got so much better, much faster. I mean, I was back at work within a month, which was pretty amazing. I did have to modify some things, but yeah, there's options, and we have most of them. If we don't have the right option for you, we have doctors that we can refer you to, or therapists that might work best with you or your lifestyle and kind of what you're looking for. But it's been quite a year, and I'm looking forward to 2025 with full recovery. So that's the plan. And that has been my past year of back healing.